Hello, my name is Christina Aguilera, and today I will be presenting my PowerPoint on national health policy. So to start, I want to go over what is policy. So policy impacts issues as fundamental as healthcare access, cost, delivery methods, and privacy. It involves the rules and regulations set forth by lawmakers on a local, state, and national level. Healthcare policy is what we're going to go into today at a national level. So, healthcare policy is an integral aspect of the United States healthcare system. So, it's one that helps shape and protect the health and well being of our population. So, that being said, as policy and law have always been in the best interest for the well being of individuals and populations, there are those who do seem to oppose what could be in the best interest of public health and welfare in the hands of policymakers. So, most recently, the United States has been affected by the national health concern of the COVID-19 pandemic. In fact, on March 11th, 2020, the World Health Organization, also referred to as the WHO, declared COVID-19 a pandemic. Over that course of time, more than 100 million people around the world had been infected by COVID-19, and more than 2.5 million people have died from the disease as well. So, due to the number of people that were infected by COVID-19, as well as the number of people who passed due to COVID-19, something needed to be done to address the health and safety of citizens at the national level. In order to do that, there are steps to policymaking in order to make that difference. There are 7 steps to policymaking, including problem identification, agenda setting, policy formulation, policy adoption, budgeting, policy implementation, and policy evaluation, all which we will go into in the next slide. So to follow the 7 steps of policy making, I wanted to establish a scenario to COVID-19 policymaking that actually became reality, which we will further address in the following slide. But that being said, going over the 7 steps to policymaking, first is addressing the problem. So the problem was COVID-19, which presented itself as a threat to the health and well-being of human beings, not just within a state or organization, but throughout the world. In fact, if one were to attain the virus, a human being's life could be at stake, no matter which state or organization they came from. Therefore, it was the WHO, or the World Health Organization, that recognized this as a national health concern that would require priority solutions. So once the problem and agenda setting was established, which was COVID as the problem, and immediate solutions being the agenda setting, it further led to policy formulation. In policy formulation, the World Health Organization reviewed all ways to tackle the virus. Once a policy ideal was identified, the WHO shared it with the Surgeon General, who then told the President and further consulted with top advisors to establish a plan of action for said policy. So, for example, acknowledging the fact that COVID was a viral concern, the conversation of vaccination policy arose to combat additional occurrences of COVID-19. And at that point, the government had the ability to adopt the policy once they investigated the legalities behind it. From there, budgeting would be set forth through Congress, and the executive branch of government would have the ability to implement the policy. Due to the fact that we live in a democratic nation, citizens in the government have the ability to review and alter the initial policy set into action. So if the policy, for whatever reason, was deemed ineffective, the steps would begin again at stage 1. Going off of this scenario, it's important to remark who is affected by policymaking. So the major stakeholders involved in policymaking include every human being. In fact, without the assistance of partnerships in policymaking, including the government, local entities, and citizen support, there wouldn't be a plan for safety, ordinance, or well-being for all. So while separate entities are important, circumstances such as the COVID-19 pandemic prove emergent collectivity for the benefit of all. When the partnerships are willing to work together and replace their overlaps rather than work against collective solutions, they can interact effectively. So looking back at the previous scenario in slide 5 of policymaking and whom it affects in slide 6, came the idea behind Operation Warp Speed. So Operation Warp Speed was recognized as the immediate solution to the problem of COVID-19. This policy ideal was identified and adopted to distribute and administer the COVID-19 vaccine. This national health policy was adopted to combat the deadly virus in a timely manner for the sake of protecting the nation and those within it. So, as the vaccine was sought after as of vital importance, $3 billion were needed in order to fund and administer the COVID-19 vaccine through the governmental public health system, primary care physicians, pharmacists, and other healthcare provider workforce, as military members were required to attain the vaccination as well. In fact, if a soldier refused to receive the COVID vaccination, they were dishonorably discharged from the military. So as these vaccination mandates began to emerge, a lot of hearsay controversy on whether or not they were necessary. So as of this year, President Biden rescinded the military's COVID-19 vaccination mandate for troops. So although service members were previously discharged due to the refusal to obtain the vaccine, they now have the ability to petition their records within the military to further receive an honorable discharge in its place. So while this may bring a sigh of relief, it also brings the question of reputability. So whether or not the vaccine filled its purpose, or if COVID-19 numbers diminished in the nation enough to rescind the mandate, it left citizens questioning where the vaccine stood in its reputability, as well as the government. Therefore, begin to question what are the facts. So the data presented in the next slides are going to indicate the questioning of safety behind the distributed COVID-19 vaccines, as well as the House's response to the questioning of COVID-19 as a threat to the nation. So as portrayed by the images in the next couple of slides, COVID-19 is no longer seen as a threat to the nation. Therefore, it can be inferred that the COVID-19 vaccines were safe and effective despite being developed rapidly. The final photos will reveal the most recent study of effectiveness in children and adults in 49 out of 50 states, showcasing that they were in fact effective. So as we can see in part 1 of our data, citizen is questioning the reputability and safety of COVID-19 vaccines. Second to last paragraph, we can see that the citizen is concerned about the vaccine for young children, as well as pregnant women, and further states in the final paragraph that Americans deserve the truth. So going into part 2 of our data, we can see the truth emerging from the government. So the government is letting us know that yes, we were once in a state of national emergency that was declared by the president on March 13th of 2020. However, due to the Pandemic is Over Act, the public health emergency has now been terminated. So that being said, we can infer that the termination was due to the success rate of the COVID vaccine. While that statement provides an inference to the data in part 2, Our data in parts 3 and 4 will further go into the statistics behind the effectiveness of the vaccine in children and adults. Here in part 3 of our data, we can see the vaccine effectiveness, age group, and the type of vaccine administered to children. In addition, we can see that, of course, the data was collected out of 49 states and the monitoring systems used in order to track this information provided. And here in part 4, we can now see the information as shown in part 3. However, in this case, it is provided on adult statistics. Not only have the statistics inferred in parts 3 and 4 of our data that the vaccine is effective, it has been proven. So now we can ask ourselves, what now? Despite the data on the benefit of the COVID-19 vaccine, many continue to oppose what was in the best interest of the public health and welfare of individuals due to the actions taken against the U.S. military during the time of their vaccination mandates. So while the vaccine was effective, there is a question behind reputability of government behaviors, executing harsh punishment in reaction to the neglect behind vaccination mandates. In addition, there are respondents who have expressed vaccination hesitancy because they have also experienced at least one form of discrimination experience within the healthcare system. So, over the years, scholars in public health and social sciences have documented the negative impacts that discrimination has on health outcomes. So, therefore, actions to retain public trust are attempting to be established. And we're going to go over those attempts in the following slide. So, a proposed policy in an attempt to regain trust and reputability is the COVID-19 Vaccination Non-Discrimination Act. This bill prohibits making federal funds available to any facility that refuses to treat an individual based on the individual's COVID-19 vaccination status, including any funding under Medicare, Medicaid, or the Children's Health Insurance Program. So Senator Rand Paul introduced the bill. It has been read twice in Congress and further referred to the Committee on Health, Education, Labor, and Pensions. He does have supporters of the bill, including Ron Johnson, Mike Lee, Tom Cotton, Marco Rubio, Cynthia Lummis, J.D. Vance, Mike Braun, and Kevin Cramer, all senators of U.S. Congress. So, in the details of this bill, we can ask who is affected by it. So, to ensure national headlines, the major stakeholders involved include Senator Rand Paul, who introduced the bill, the partnerships of government, which would include the Republican Party support as his current affiliation stands, local entities, and citizen support. When the partnerships, of course, are willing to work together and replace their overlaps, as we discussed previously, they can interact effectively. So there will be parties who, of course, oppose this bill due to their wish to keep the vaccine mandate in place. The reason behind that is because they may ask themselves, why alleviate the mandate if it's been working to bring down the COVID numbers as far as deaths, as far as infections. But that being said, government has established that we are no longer in a state of emergency since the Face of the Pandemic is Over Act. However, after reviewing the discrimination that occurred within the pandemic's timeframe, it is in the government and people's best interest to advocate for this bill and the discriminated parties involved. The ways that we can do this are via education. For example, physicians conveying the facts of vaccine benefits through statistics and allowing patients to then make educated decisions for themselves without discrimination of COVID vaccine status. And of course, via media, providing reputable statistics and showing vaccination as a choice due to the elimination of crisis following the pandemic. So, this would further enable nationwide discussion and understanding for change. Next, we would present the facts. So, the data that's going to be presented in the next few slides will indicate the hesitancy to receive the vaccine when discriminated against. So the first slide represents the equality between racial discrimination and the hesitancy to receive the COVID-19 vaccine. The second slide then proves additional discrimination against military personnel, as receiving the COVID-19 vaccine was once considered in order. This confirms the need for the proposed or introduced policy in order to regain public trust and government reputability in healthcare. As we can see in part 1 of our data, the correlation between vaccine hesitancy and discrimination experiences is also alongside racial discrimination. In total, 41% of people have experienced discrimination, which has led to further vaccine hesitancy. That being said, additional nationalities have been listed in the percentages in which have been discriminated against. Part 2 of our data, we could see the U.S. Department of Defense addresses that in the past, commanders, on the advice from medical professionals, could simply order service members to get a vaccine. Because of this, the U.S. Department of Defense recognized that soldiers, sailors, airmen, Marines, and Guardians must make the decision for themselves. This furthermore reinstates the need for the adoption of the COVID-19 Vaccination Non-Discrimination Act. As every bill is anticipated to pan out according to its benefit, there are unintended consequences that could occur as a result of the bill as well. For example, this may cause further confusion to how the COVID-19 vaccine is beneficial or not, if we shouldn't take the status of them seriously. If patients are unaware of the background provided in this presentation, as most of them will not be, they may be misguided on the new bill. This may present a need to re-review the steps of policymaking and possibly add in additional information to make it easier for the public to understand. In closing, my recommendation is to enact an amendment to this policy to showcase the facts of life following the pandemic. That would include having organizations like the UN or United Nations coming together to address the benefits of the once mandated COVID vaccine versus the lifted mandate and what that looks like in one's country. They could share what one's advocacy programs look like and how they'd enforce education to ensure it's reached amongst their citizens. By simply stating that the U.S. passed a bill to terminate the national emergency concerning COVID-19 and introducing a new bill regarding a COVID-19 Vaccination Non-Discrimination Act, it can make citizens question where the accurate source of information is to follow. To avoid further questioning, the amendment can look something like life after a pandemic. The bill would not only address the issues of discrimination, allow U.S. citizens to become informed on the facts, statistics, and presented information regarding why the mandates were necessary and what the plan will be moving forward in order to regain trust and credibility. By utilizing advocates such as teachers, doctors, and the media to present educated information, this tell-all bill unified the public's concerns of life after a pandemic.